We are celebrating a milestone for the Rio Grande Valley, and Francisco, I might add, for the entire state. When you look at this regional academic health center, men and women who are developing their skills to deliver the needed medical care in a part of our state where for too long we have not had the expansive healthcare delivery system that we deserve. As these young bright faces behind me fulfill their requirements for their medical residencies, and these are students. I asked them all where they were from, and there's so many of them that are from this area that are going to not only be educated here, that are going to stay here, and they're going to be part of a cavalcade of young professionals in the healthcare area who are going to be delivering the needed health care in the valley for years to come. This is vitally important in this area, who, as I said earlier, who have been dealing with a short fall of caregivers for far too long. As Leonel shared with you, we have been dealing with this issue since 2003. We've been delivering on this today's culmination. Senator, I think it was back in '03 when we passed some sweeping changes to our legal system in 2003. And ever since, the citizens of Texas voted for Proposition 12, the number of doctors applying for medical licenses in the state of Texas has skyrocketed. It's gone up by some 57%. I love sharing these numbers as we go across the country, and I talk to my brother and sister governors, and I don't make any. I tell them, I said, it's not bragging if you can do it. And I said, this is what we've done in the state of Texas. In 2008, the Texas Medical Board received more than 4,000 applications for medical licenses, and they issued a record 3,621. In 5 years after those reforms passed, nearly 14,500 doctors either returned to work in Texas or began practicing here for the first time, many of them in areas that had previously been underserved. Here in the Rio Grande Valley, applications are up 18% for those licenses, and about 200 more doctors are practicing here today than there were in 2003. That's 200 more physicians who are setting broken bones, who are overseeing the safe delivery of babies, who are handling trauma cases that before were having to be transferred to San Antonio. And we know the outcome in all too many cases with the transfer of those types of injuries that far away. It was not a good story. According to the most recent figures, the South Texas region only has 57 physicians per 100,000 citizens. And by comparison, the statewide average is 157 physicians per 100,000, and nationally it's 221 per 100,000. We're still behind the curve, but we're making good progress towards catching up. And at the same time, Eddie, you and I were talking about this, the ratio of Hispanic graduates from Texas med schools doesn't line up with our overall Hispanic population. And nearly 36% of our state's population claims Hispanic origin, while less than 12% of our medical school graduates can do the same thing. We happen to think we can do better than that. And this facility is one of those that's going to help us move in that direction. We're here today. We're here today to build on our success that we saw with our tort reform efforts, continue increasing the quality and the quantity of medical care here in the Valley by ceremonially signing Senate Bill 98 here in a few moments. It allows for the University of Texas system to convert the lower Rio Grande Valley Regional Academic Health Center, the RAC as we refer to it, into a health science center. The new center will be called the University of Texas Health Science Center, South Texas. It's a big deal. It's a really, really big deal. And, you know, it's these types of events that I like to point out to people that this country we live in is an incredible country. And the things that we have, the things that we've acquired, were created oftentimes by great sacrifice. And I'd like those veterans in the back row to stand up just a second. Thank you, ladies and gentlemen, for sacrificing. So these young people could be here today. Not just dreaming some dreams, but making those dreams become a reality. And we will be forever thankful for your service.
Did you get it?